Broadcasting from the business capital of the world, this is the Podcast Business News Network.
Physician, life coach, and so much more. We are back here today live with Dr. Janet Little. How are you?
Hello. Great to be back.
Same here.
Thank
Great to
you.
see you. So Optimal Vitality is the name of your company and the website, optimalvitalitydoctor.com, correct?
That's correct. Absolutely.
Please give yourself a little bit of an introduction. I mean,
All right.
there's a lot to you, so I'll have
Yeah.
you.
Well, as you introduced me, I'm a doctor of family medicine by training. And through my journey of being a family medicine doctor, I became a life coach due to the fact that I needed my own coach, and the lessons that I learned as a student allowed me to apply it and help other people. So with my coaching, I really focus in on resilience, and we all have it, but sometimes we just need a little bit of help in bringing it out. And what I do, because of being in medicine, I work with everyone essentially, but because of my background in medicine and understanding the secondary trauma that healthcare professionals go through, oftentimes that can lead to burnout. I really do work with, or I specialize in working with other healthcare professionals and helping them to live the life that they want to live and not have to sacrifice their health and well-being.
Yeah. Well, thank you for sharing. And I know today's topic, you wanted to talk about mental health awareness.
Yes.
Go ahead.
Yes.
Platform.
So May is Mental Health Awareness Month, and it's really a time to focus in on the importance of mental health. And oftentimes when we think of mental health, we have this stigma about it.
Yeah.
And I think it's time that, particularly in the year that we've had, to really have an open, juicy, heartfelt conversation about mental health, what it is and what it isn't, and really learning what are those things that we need to do to really maintain our mental health, especially given the year that we've just had.
Ooh.
And continue to go through it.
It's been a tough one, right? For sure. The increase in anxiety, stress. I mean, as a doctor, as a life coach, I'm sure you're dealing with a lot of people who are having issues with mental health and maybe not know how to address it all. So could you just give us a definition of exactly what mental health even is?
Yeah, absolutely. But before I begin, I do want to say that anything that I say here is not meant to self-diagnose or diagnose someone else. This is all just for your edification, your educational purposes. And that if you are suffering from any mental health disorder, that it's important that you get the help that you need. So I wanted to start that before I even go into talking about mental health. But what mental health is, the World Health Organization has, I think, beautifully defined what mental health is. And they define it as a state of well-being in which every individual realizes his or her potential. They can cope with normal stresses of life, they can work productively and fruitfully, and can contribute to his or her community. And it says nothing about good or bad.
Okay.
So it's a state of well-being.
Okay.
And so it's not saying that good mental health means that you're going to be 100% happy all the time. That's not realistic. But it's also not saying that you're ignoring real issues that are happening.
Yeah.
It's saying that you're able to cope with those normal stresses in life.
Got it. Now, could you help us out and define between the issues of mental health and mental illness? Because that might be a little confusing to some of us.
Yeah, absolutely. So there definitely is a distinction. And so bottom line is that we all have mental health, just like we have physical health. But whether it's good or bad, that's up to the person, the individual. And so mental health, we have it at every stage of our life. Whereas where mental illness, it really refers to health conditions involving changes in one's emotions and their thinking and the behavior. And you can have a combination of all this. And I'm not going to focus in on like particular diagnoses or anything like that, but we're all aware of the different types of mental illnesses out there. And so when you think of illness, it usually has that connotation of a need for medical intervention.
Yeah.
Whereas mental health is the overall
Okay.
picture of it.
Mhm.
So, and that illness is usually associated with the stress or problems functioning in one's social, work, or family activities.
Got it. Now, you say there's many types of mental illness out there, and simply knowing that a person has a mental illness really doesn't tell you how well or unwell they are, right?
Not at all. Not at all.
Is there
You can have
yeah,
people
mhm,
with mental illness that are functioning
normally.
very well, and
Well,
you don't wear it.
got it.
You
Well,
can't see what's going on in somebody's life. So
can you tell us maybe how common mental illness is?
yeah, absolutely. So surprising numbers, and these numbers are probably pre-COVID numbers that I got. So
Okay.
and it's probably a little bit higher, but mental illness is among the most common health condition in the United States. And more than 50% of people will be diagnosed with a mental illness or disorder at some point in their lifetime.
Wow.
And with mental illness, it can occur at any age, but 3/4 of all mental illnesses typically will start by the age of 24.
Unbelievable.
Yeah.
Wow.
And it's going to be interesting to see what in the coming years, what those numbers spike to as a result of this pandemic.
Absolutely. And would you say there a continuum of mental health?
Absolutely. So since an individual's mental health can change depending on the circumstances, whether that's a acute problem that causes you to go from healthy to or good mental health to bad mental health or mental illness, or you can have long-term stressors that can impact your mental health. So this continuum really identifies mental health conditions that can be managed with self-care, as I always talk about, skill building, emotional intelligence, getting support, learning different strategies to help you cope. And then on the other end of that spectrum, it can be more severe conditions where we need the support of a professional health provider to intervene. So, for example, there's like 4 phases of this continuum that they describe. So you have your healthy person that is thriving, their emotional health is optimal. And then you have the reactive phase,
Yeah.
where I think a lot of us, and I will put myself in that category right now, that we're reacting and we're coping.
Yeah.
And so there's a lot of uncertainty. And so, and needs are not being met. And so someone who was thriving 18 months ago may be in the coping phase of just trying to get through their day when it comes to mental illness. And then you get the other end of the spectrum of the injury. And that's where you have someone who's struggling and they're starting to show significant functional impairment in their mental health. And then the very extreme is you're ill, where they are suffering and may be diagnosed with a clinical disorder and have real severe and persistent functional impairment.
Now, you also say it's important that you can move in either direction along
Mm-hmm.
the continuum. Could you
Mm-hmm.
explain that a little bit? So, at any time, again, you could be healthy in a sense, right? And
Mm-hmm.
thriving. The other side, you could fall ill.
Right, exactly. And there isn't any
Oh,
magic pill or situation
yeah.
that can predict whether somebody is going to go from one phase to the other. But you can definitely go from healthy to reacting to injured to ill, but then you can also come back.
Wow.
And that's with getting the appropriate support, whether that's through coaching or whether that's through a professional like a therapist, medication, things like that
Good. And
can
practicing
help
good
you.
mindfulness. We can talk about that in a little
Absolutely.
bit too. But
Hmm.
I want to know, how is it and when do you know when it's time to seek help? Is there any, things that can really help us, pinpoint, hey, maybe it's time to seek that help?
Hmm. Hmm. Yeah, and I think too often we get caught in our day-to-day lives and think that, oh, I'm a little bit stressed, but not realizing that that stress is building up and having an impact in several areas of our lives. So you have your mood can change. And for some people, they can bounce in and out of mood. But when that mood goes to the extreme, where it's unrecognizable to you or to other people, then yeah, maybe that anger is not just that one time angry about a dish being left in the sink.
Yeah.
It's your you just snaps.
Yeah.
Then maybe it's time to seek some help. Your attitude changes.
Hmm.
You're not that bubbly person. And as I said, with everything that we're going through right now, everyone's attitude has changed. It's like you don't feel like you have that drive to do those things that you had fire for before. So even those little small little things, it's good to be aware of them. Sleep, that's a big thing. Are you sleeping too much? Are you not sleeping enough?
Yeah.
And again, even before the pandemic, I think a lot of us were dealing with this, but it just really brought out
Hmm.
a whole lot. And then, of course, your physical health. Um, if you're low in energy versus fatigue and exhaustion and just constant fatigue, those things are things to look out for,
Really red flags
which
in a sense.
red flags, absolutely,
Okay.
which then impacts your activities
Mhm.
of you were once a physically active person and now you just don't have any energy at all to muster just to get up to do your daily activities. And then of course habits, the things that we do on a day-to-day basis, whether they're good habits or bad habits. If we're starting to pick up those bad habits of drinking or gambling or
Yep.
excessive shopping and things like that, then yes, those are things to also have to consider. Uh, is it time to seek help?
Got it. Wow. So, are there any action steps that we could discuss here today about to help people along their journey in a sense
Absolutely.
on this
Yeah.
continuum?
Absolutely. So let's talk about it. Let's go from those different phases. So in the healthy phase, when you're maintaining your personal and professional potential through self-care, and we talked about different types of self-care, and it goes well beyond getting massages, pedicures, and manicures. Those are great, but really self-care for the mind
Yeah.
and being mindful and taking time out, positive thinking, intention setting, which I think is more of an internal thing versus goal setting. And then really looking at your life from a holistic perspective of making sure, am I acting or am I responding with optimal vitality, I should say, and different in all the areas of my life, whether it's physical, social, career, financial, emotional, you name it. And am I thriving in all of those areas of my life? And if not, how can I bring back in the self-care. And then from the reacting phase, that's where you want to access any of those resources that you have. Seek social support to help you improve your performance, improve your resiliency and your coping skills, and to really achieve your optimum emotional health. And then when you get to the injured and ill phases, those are the phases where you really want to seek professional help.
Mm-hmm.
Um, and I am really cautious in making sure that if I am coaching someone that I see has those red flags of injured and ill, we can, in conjunction,
Ben.
coach and have therapy.
Mm-hmm.
But it's important that one, I stay in my lane, even though I'm a doctor. I think it's important to make sure that you're in the right hands to get the support that you need from a therapist or through medication if that's necessary.
Great. So the healthy phase, the reacting phase, the injured phase, into the ill phase in a sense. Yes,
Mhm,
where you'll need to work on someone. Now, as a coach and also as a doctor, though, I know you're not licensed to prescribe people medicine as a coach, right? But
correct.
could you recommend to someone that you think it's time for them to seek a medical doctor? I mean,
Yes, absolutely. And I've done that with my
okay.
clients as well, particularly when I'm noticing that we're not moving forward in the coaching process because you're fixated on either the past or those problems that are not getting solved,
Got
so
it.
to speak. And the coaching process, it does take time. So, but I think after probably 3 or 4 sessions, we can probably tell what's going on and if there's a higher level of need for the client. But it's one of those things where it's like, I just want to plant the seed. And oftentimes
But
early on, the client's not ready.
no,
And it's not that I'm going to bag them. Hey, you need to seek a therapist. That's the last thing I want to do.
got it.
And abandoning my client is again the last thing I want to do. So okay, but I need you to be aware. This is what I'm concerned about.
Mm,
And like I said, I've had clients that have been resistant initially to coaching or initially to therapy and wanted to continue that coaching process. And they realized, yeah, I'm not making the strides that I want to make. So they've gotten a therapist and then we work together to get them the energy that they need, get them in that good mood that they need to be in so that we can help them elevate
yeah,
their mind to the next level.
great. And also, can we talk a little more about how coaching does play into helping someone really through this process along the continuum?
Absolutely. So oftentimes I think people who are in that healthy phase, they don't think they need help. And I want to let them know that coaching is not just for when you have a problem. Don't wait until you have a problem. If you have a goal or an intention, but you can't seem to get started or you want somebody to help hold you accountable, coaching would be great during that process.
Mm,
And then, like I said, where a lot of people probably are, where they've gone from healthy to that reactive stage, that they're just coping through this tough time right now. And what they probably need is just a safe space and to have somebody to hear them and support them as they try to move back into the healthcare before they
yeah,
get to the injured or ill phase.
got it.
And so really understanding what someone's needs are. And they change from session to session. Somebody maybe feeling great during the first or second session, but come to the next session with, you know what, I'm not feeling great in this area. My mood has changed.
Yeah,
Let's talk about it. And so we have juicy conversation. We're not going to just stay on the surface level. We're really going to dive deep into what's happening, how can we now move forward? Because the beautiful thing about life is that we have choices.
Yeah.
And some people just feel like they no longer have a choice. And so helping people remember that they can live in options and possibility and choice really helps open up the mind.
Beautiful. And let me ask you, we mentioned a little bit before about mindfulness. Any tips and advice as a doctor, as a coach? What are some of the things we should be doing every day that can maybe help us start living a mentally better life? Is there anything you'd recommend?
Yeah. So in terms of mindfulness, it really is about paying attention to those little things in life. I'll give you an example today. I was driving my son to school,
How
and
old is he, by the way?
he's 12.
Okay.
Yeah, or actually, I just say he will be 12 next week on the
Okay.
12th, on the 11th. I'm sorry, but just driving him to school, and I just happened to glance over and saw him smiling. Those little things in my head, I had everything going on in my head. I got to do this. I got to do this. I got to stop and do that.
Uh-huh.
And just being able to stop and look at nature, at your loved ones, at life, and just really be able to smile and say, you know what, I have something to be thankful for.
Yeah, for sure.
And gratitude, if that right there, gratitude is a huge thing that to bring somebody to mindfulness.
Beautiful. And on a daily basis, do you recommend waking up and any habitual things, like you mentioned, maybe journaling, maybe writing stuff down?
Journal, yep,
Um,
absolutely. Journaling,
I simply wake
exercise.
up and I just thank the Lord, whoever it is up there, for what I have, my children, my family.
Mhm.
It's going to be a great day. And I try to be as positive as possible. I mean, I'm naturally positive, but I really feel that love and energy about living each day to the fullest. And this
Absolutely.
horrible year has really made me extra positive in a sense, very
Mhm.
thankful
I
and
love
very
it. Oh, I
grateful
love it.
for this. So I try to wake up every day. That's my little, advice. I'm no doctor, I'm no coach, but
Mhm.
wake up happy. Look around,
Mhm.
be thankful you're alive. And,
Exactly.
I think that also is just helpful as well. The positivity
Exactly.
aspect of trying to remain
Gratitude.
positive, but not everybody can. Yeah, the gratitude
Yep,
for sure.
absolutely. And if you ever notice, like when you're in a room with negative people, that can bring your mood down.
Yeah,
But I think being in that positive light as well can spark the light in the room. And I think that's what we need right now. We need more light sparkers.
absolutely.
So Jill, you continue to be a light spark.
And so now you work, where are you based out of? Where do you live?
I am just outside of, I'm like in between Baltimore and DC. Nice little place called Hanover.
Got it. But you work with your clients this way, right? Zoom, on
Everywhere.
the phone, virtual.
On the phone, like Zooming and Skype and all those things. Yes, I will work with you anywhere around the world because we're closer.
Yeah. And
Closer and we can
normally,
do that.
how long does it take to work with someone? I mean, I know it's different for everyone, but just
Mhm.
to get a sense of how long it takes to actually mentally change the thought process, to change behavior processes, and to help someone's mental health. How long, do you recommend working with someone initially for?
Usually I recommend about 8 sessions, 8 to 10 sessions. Some people may need more, some people may need less, depending on where they are. Because some people might just, you know what, I'm just stuck in this one thing, and all they need is just one tweak and they're off.
Yeah.
Other people, they have a whole lot to unpack.
Yeah.
And so we go through the different life zones
Mm,
that they're dealing with and say, hey, where do you want to start?
got it.
And so we're not going to just go in and say, here's a little good feeling pill to help you get through each area of your life. No, let's break it down. If there's issues in your relationships, whether it's romantic relationships or your friendships or your family relationships, let's talk about it and how we can get those better. And then if there's areas that are better in your life, how can we pull resources from those good areas to bring up the other areas that you want to look in.
Got it. OptimalVitalityDoctor.com is the website. What about phone number? Any other forms of contact for you?
Yes, find me on Facebook at Optimal Vitality MD. That's a safe space where I love to post positive messages, little educational tips that you can take with you to help build your resilience muscles. I'm also on LinkedIn as Janet Little MD. And then you can contact me directly at 443-492-9578.
And on Facebook, LinkedIn,
Yes.
and you offer
And
30-minute free consultation, correct?
yes, I do. And those consultations are just like clarity sessions to make sure that we're a good fit. And I hope you will find me to be a good fit. I try to be down to earth. I'm not perfect. And I will admit that right there, that I'm still on my journey, and I have a coach. As a matter of fact, I just got another coach. So it's important to me that I stay well grounded.
Absolutely.
And be able to provide that support for my clients as well.
Dr. Janet Little, pleasure speaking with you again
Thank
today.
you.
Thank you so much for your time, and I hope
Thank
our
you.
reach out. You have a great day, okay?
Thank you as well.
Everyone else, stay tuned. More of the show is coming right up after this quick break. Don't go anywhere.
Broadcasting from the business capital of the world, this is the Podcast Business News Network.
For nearly 2,000 severely injured veterans, everyday life has become filled with barriers.
Day-to-day simple tasks can become pretty daunting.
I have to carry my chair up 2 flights of steps or have somebody do it for me.
What scares me the most is just the falling.
When I'm struggling with my house, I think, to have that one great barrier just knocked down, it's crucial.
Home for Our Troops is a wonderful nonprofit that builds a
Mortgage-free, fully adaptive, handicap-accessible house. And there's no catch.
It'll be our very first home that we've ever owned.
This is a game changer.
This is where your life begins again.
We need you to join us in completing this important mission. Please visit hfotusa.org and help build homes and rebuild lives.
Because of you, everything's going to be okay.